know who should be paying for this, charges high fees to the doctors and don't pay the benefits.
I wanted to turn to Dr. Atul Gawande. He is well-known staff writer for The New Yorker, doctor in Boston. We asked him about the issue of health care overhaul. And the State of the Union address, President Obama defended his health care overhaul and invited Republicans to help him move forward with essential fixes to the law.
Now, I have heard rumors that a few of you still have concerns about our new health care law. So let me be the first to say that anything can be improved. If you have ideas about how to improve this law by making care better or more affordable, I am eager to work with you. We can start right now by correcting a flaw in the legislation that has placed an unnecessary bookkeeping burden on small businesses. What I'm not willing to do is go back to the days when insurance companies could deny someone coverage because of a pre-existing condition. As we speak, this law is making prescription drugs cheaper for seniors and giving uninsured students a chance to stay on their parents' coverage. So I say to this chamber tonight, instead of refighting the battles of the last 2 years, let's fix what needs fixing and let's move forward.
That was President Obama in his State of the Union address. A few weeks ago, I spoke to Dr. Atul Gawande, the surgeon at Brigham and Women's Hospital in Boston, who's a staff writer at The New Yorker magazine, and I asked him to assess President Obama and his whole approach to health care reform, and to talk about how President Lyndon Johnson passed Medicare legislation 40 years ago. What was the clincher that secured Medicare, which they do seem to be trying to unravel right now, even now, 40 years later?
Presidential leadership. I told about the president sending inspectors into the South and confronting the hospitals that were basically a stare-down that occurred. But with the physicians, he was more conciliatory. He had this amazing moment where the president of the American Medical Association came to the White House to explain that the AMA was going to vote on potentially boycotting Medicare as a whole. And the president sat down with the leaders, and they came to the Oval Office, and so he sat down, and almost they were about to start talking, and he stood up. And when the president stands up, you stand up. And so they all stood up, and then he sat down, and then they were about to talk again, and then he stood up again, and he scratched his belly, and they waited, and then he sat down again, and they did it a third time, and suddenly it was clear who was in control of this meeting. And before they could even start talking, he said, "You know, I'm worried about Vietnam. You know, the citizens there, the civilians, we see terrible health care problems there. Do you think the American Medical Association would be willing to help us with a volunteer corps of doctors to help the civilians in Vietnam?" And the president of the AMA said, "Absolutely, we'd be happy to do that." And he said, "Great, let's call the press in here, have a press conference right now." Got the press in, explained that the AMA is going to back this voluntary program to send doctors to Vietnam. And then, of course, the next questions from the press were, well, what about this boycott we hear is going to happen? And the president says, you mean to tell me that these doctors who would volunteer to help the poor in Vietnam wouldn't help our elderly here at home? And turned to the president of the AMA and said, you tell them what you think. And the president of the AMA said, well, we will support Medicare. And they entered a period of several months of negotiation that led to improving amendments, but moved them from total opposition to talking about how to get them under the fold so that you could make this thing work. Only thing that can move the public to recognize the value and the meaning of what we have with policy. We will have the battle back and forth between pro and con and so on, but the only person who can lead that same kind of experience is going to be the president.
Well, what did you think of his leadership in the health care reform
I was frustrated by it. The leadership with Congress was incredible, getting the votes, getting the detailed understanding of what you need to get everybody together. It was a Lyndon Johnson masterful performance. In fact, the whole year has been an incredible Congress that has been able to pass all kinds of blocked reforms that have been important to make some progress on. But you also have a role, there's leadership needed to give meaning to the policies for the public and to explain what the value is. And that communication for one of our great communicators in the campaign, I'm not sure the reasons why. I understand that energy is divided between trying to focus on the congressional job and so on, but it allowed the opponents to brand every one of those policies as failures, even though they passed. And that, and it's not just about branding. It's about being able to tell the story of where we have been, where we are going, and help people understand the vision of what we we need for the economy, for healthcare, and so on.
That was Dr. Atul Gawande, surgeon at Brigham and Women's Hospital in Boston, staff writer at The New Yorker magazine. In a minute, we're going to go to Harry Belafonte, assessing what President Obama has accomplished in this 2 years. But before we go to him, I want to get your assessments. Joan Claybrook, you actually worked with Johnson in the administration to pass Medicare.
Right. I was at the Social Security Administration, and it was very tough. And Johnson was unrelenting. And he went after every member of Congress and got their vote that he possibly could. And it gave such enthusiasm to the people who were trying to help design the program. And it's changed America. You know, America is a different place because of Medicare.
And yet many in Congress are saying, particularly the Republicans, but Democrats joining them, it's Social Security and Medicare that are bankrupting us.
That's right, but we should have Medicare for all. And if we had Medicare for all, then, you know, this nation would be so much healthier, and the costs would go down because people would go to the doctor when they needed to do so.
Finally, your overall assessment of President Obama at this point. Rocky Anderson, former mayor of Salt Lake City, who took on the Bush administration perhaps like no other mayor in the United States.
We need leadership on these issues. It's just what we've been talking about, comparing the Johnson administration on Medicare. Look at what FDR did on Social Security. We have none of that leadership anymore. And I think money, the corrupting influence of money and politics has a great deal to do with that. But look at what this president could do on issues like climate change. He didn't even mention it last night. The Rasmussen Report survey just showed that 41% of Americans think that President Obama either believes that climate change is just a natural process or they don't know his position. 41% of Americans. Why don't they know? He didn't even mention the issue during his State of the Union. And in terms of climate change, the State of the Union, State of the world is very, very poor and dangerous.
Tea Party is powerful here in Utah.
The Tea Party, because of the Tea Party, Senator Bennett was defeated. And I think Senator Hatch is going to be threatened by the Tea Party here.
And so the response, do you think, if President Obama wants to be president again?
I think what we need is somebody who will stand up. You know, he sounds like a broken record about this bipartisanship. What we really need is a strong leader who believes in setting the course back straight. And it's not through trickle-down economics. It's not through these massive tax cuts for the wealthy. It's not in backing down on climate change. It's taking a stand and saying we're going to provide health care for everybody in this country, and we're going to address the problems that are going to impact not only those of us today, but our children and our grandchildren for a very long time. And it's not being done by this administration or by this Congress.
Look what happened with Bush. A lot of people didn't agree with George Bush's policies, but they respected him because he fought like a dog to try and get those things enacted into law. And I think that the American public respects strong leaders, even if they don't always understand or completely agree with everything they say.
We're going to leave it there. Joan Claybrook, President Emerita of Public Citizen, and Rocky Anderson, the former mayor of Salt Lake City and founder and director of High Road for Human Rights. That does it for this segment. When we come back, we'll hear from Harry Belafonte, and then we'll go to Egypt. Unprecedented protests, at least for, well, more than 30 years. This is Democracy Now! Stay with us.